Welcome everyone to the United Nations Association of the USA's first Global Engagement Online Series, also known as GEOS. My name is Rachel Bowen Pittman and I'm the Executive Director of UNA USA. Please note that this session is being recorded. The GEOS series is an extension of UNA USA's mission to educate, inspire, and mobilize Americans to support the principles and vital work of the United Nations. Throughout the rest of the year, even when social distancing has ended, you'll have the opportunity to tune in to these live webcasts for unique discussions with global issues experts. The Global Engagement Online Series will also allow us to celebrate and acknowledge the UN 75th anniversary this year and hear expert perspectives as we engage our communities in the UN 75 campaign to shape a brighter future. Links to the archived recordings of all GEOS sessions, including this one, will be posted on unausa.org. Today's session is on the UN Agency Response and Action on COVID-19. Our guest speakers will include Sarah Craven, Director of UN Populations Fund Washington Office, Megan Gilgan, Deputy Director of Public Partnerships Division for United Nations Children's Fund, Jana Mason, Senior Advisor of U.S. Government and External Relations for the UN Refugee Agency, Yesim Oruc, Deputy Director of UN Development Program at the Washington Representation Office, Stewart Simonson, Assistant Director General of the World Health Organization's Office at the United Nations in New York. If you would like to read their bios, please go to the chat box located on the left at the bottom of your screen to link to them online. For today's webcast, I will be joined by Farah Eck, UNA USA Senior Director, who will help moderate the program. I will have a conversation with each speaker and close with a Q&A session. Throughout the program, please feel free to type your question in the Q&A box at the bottom of your screen on the right. Questions will be monitored by Farah, who will share as many as possible during Q&A. So we have a lot to cover, so let's get started. You know, right now, our country and planet are experiencing an unprecedented global pandemic known as COVID-19. Whether it's the impact on vulnerable communities, the lack of protections for migrants and refugees, the disproportionate effects on women, or the unintended consequences on children, the impacts of this novel virus is substantial for the UN's work. So for each of you panelists, speakers, please take 2 minutes and tell us how COVID-19 impacted the work of your organization and the communities you serve. Stewart, let's start with the WHO.
Thank you, Rachel. I would say it would be very difficult to overstate the impact of COVID-19 on the WHO. We have been full-time and full speed on this since December 31, January 1, so almost 100 days. And there is not an office or a unit or division within WHO that is not in one way or another working on the COVID-19 response. But we still have other activities going on. All of the other health problems that we're facing remain. They don't go into some sort of stasis while we respond to COVID-19. So, for example, the polio eradication program is still going forward. The work in North Kivu to suppress the Ebola outbreak is still ongoing. And in fact, we're approaching a very important milestone. So all the more reason why we cannot take our eye off the ball in North Kivu. Plus, connected to a major public health emergency, a pandemic, a once in 100 years pandemic, as we are experiencing now, is a whole suite of adjacent issues, mental health problems, non-communicable disease problems, domestic violence. All of these things have subject matter expertise within WHO, and we are working to leverage that to improve our response, as well as continue our workaday mission, pre-qualification and malaria control and dengue surveillance and influenza surveillance. We mustn't forget that there are other threats that are on the horizon, including influenza. And it is WHO's influenza surveillance network around the world that informs the vaccine supply every year and what goes into the vaccine supply, I should say. So there is a lot happening at the same time that we are responding to the greatest public health emergency of our time.
Right. Thank you, Stewart. And Sarah, what's been the impact with UNFPA?
Thank you so much, Rachel, and hello to everyone who's online all around the United States. It's very exciting to be part of this. I'm not sure how many people online are so familiar with UNFPA, so I'll just quickly say what our 3 goals would be on any good day, which is ensuring that no woman dies giving life. We ensure safe pregnancy and good maternal health outcomes for a pregnant woman and her newborn. We help women and families who want to plan and space their families by having access to contraception, voluntary family planning methods. And 3, we are the UN agency that takes the lead on addressing and responding to gender-based violence. So on a good day, our mission is a daunting one, an incredibly important one, because we're there to ensure that women can bring life into this world and be able to plan for that. So when you have a once in a lifetime, once in 100 years pandemic, this only further exacerbates, the impact that these issues have on fragile healthcare systems, women and girls who are often very marginalized or vulnerable to begin with. So we're addressing those challenges and seeing those challenges. We're seeing the disruption in healthcare services. We're seeing worsening inequalities between women and girls and deepening discrimination for those who are already marginalized groups. Unfortunately, we're also seeing, as Stewart referenced, an increase in gender-based violence and sexual exploitation and abuse. Unfortunately, when people are in confined spaces, when they are feeling fragile economically, when there is disruption in society, in any case, we see spikes in gender-based violence. We also see, which is incredibly important, and I know that all of the speakers are going to address this, is that women represent 70% of the healthcare workforce. So it is women who are often on the front lines, and we are seeing that women have to address their, women healthcare workers need to have their needs addressed. I'm running out of time, but I'm just gonna make one more flag, which is also on the supply chain for medical supplies, contraception, and others, and protective gear, which all of our agencies are facing.
Thank you, Sarah. And Megan, can you talk about the impact to UNICEF?
Absolutely, and welcome everybody, wonderful to be here. I mean, one of the most obvious impacts that I know parents and families around the United States are also experiencing is that we have 90% of the world's student population that's not going to school. So that's 1.5 billion children. And I think we can't underestimate the impact that that has on children, on their families, and also on the future economies of the world, because we know that when children are out of school, particularly low-income children, the chances of getting them back into school get lower the longer that they're out of school. I would say the second issue is UNICEF has worked for many, many years on things like hand washing and behavior change, trying to work with communities to make sure that they practice the right hygiene, but also that they understand the importance of healthcare and immunization. And that now, as we know, is absolutely critical to preventing the spread of the virus. So huge scale up in terms of our work on social mobilization for behavior change, and particularly on hand washing, and we've been doing that around the world. I think the third issue I would highlight is UNICEF has one of the largest humanitarian warehouses and supply operations of the UN, and so we have been reprofiling a lot of that to try to bring in personal protective equipment to support the vulnerable health systems around the world. And I think the last thing that everybody has also said is that often when we experience emergencies in the UN, we're used to mobilizing the whole organization to address a number of emergencies across the world. But this is a situation in which we are all impacted. So it's very much a global mobilization, and really everyone around the world is experiencing, in some senses, similar issues in terms of social distancing and limited movement. So we're learning a lot, and really have been impressed, as I know everybody else has, with how our teams around the world have stepped up to really continue the important work that we were already doing, but but really to surge to make sure we can support the COVID response.
Right, thank you. And Jana, why don't you talk a little bit about what's going on with UNHCR?
Sure, thanks Rachel, and thanks for inviting the UN Refugee Agency to participate. You know, UNHCR by definition is an emergency response agency, which is probably the same for a number of UN agencies as well as some of our NGO partners and others. You know, the nature of our emergencies, since we are assisting displaced populations and since people tend to remain displaced for years and decades because unfortunately wars just go on and on. So the nature of our work is what we sometimes refer to as protracted emergencies, which sounds a bit like an oxymoron, but that is what we do. We're assisting victims of war, violence, direct persecution. Of the two main populations that we serve, refugees who have crossed an international border and internally displaced who are still within their country, you know, we see some differences. Refugees by nature are usually in a safe environment. Say, for example, Syrians in Jordan. Jordan's a safe country. They're still vulnerable. Even before COVID, they were vulnerable. Often they have limitations on freedom of movement. Even though most refugees aren't in camps anymore, more and more they're in urban areas, they still have movement restrictions. They often have difficulties accessing livelihoods, basic assistance. They're subject to discrimination, harassment. So you have those challenges that we're already used to. For people internally displaced, we're talking about people in war zones, people on the front lines of conflict. You have security challenges, access challenges, public health systems in the best of times decimated by years of war. So we're used to these challenges. We're used to never having enough money, never having enough resources. And unfortunately, we're also used to dealing with epidemics. Even before COVID, we were impacted, displaced people were impacted by Ebola, cholera, measles outbreaks, all sorts of public health situations. So on the one hand, we're prepared as an emergency response agency, and about 90% of our staff is already in the field, often in the deep field. On the other hand, we have to acknowledge, like everyone has, that COVID is like nothing we've ever seen before. With most of our staff being in the field, we won't leave. I would say we don't have the luxury of leaving, but we don't even want to leave. We consider ourselves one of the providers of last resort, as do a number of other agencies.
Right.
So our goal right now is what we call stay and deliver. We are continuing our life-saving assistance, which was life-saving even before COVID, and now we're shifting to COVID response too. And our biggest fear, what keeps us awake at night, is that resources will be shifted from existing life-saving response to COVID response, and that's going to put us in a disastrous situation.
Right, thank you. And Yesim, can you talk to us about the impact UNDP is dealing with? I think Yesim, your mic might be off.
There you go. Thank you. Thank you much. Thank you everybody for joining in. Your wind in our sails. We really, really appreciate this opportunity. As Stewart said, business as usual. Of course, we try to continue our normal work on a day-to-day basis. But let me underline this: the COVID-19 health crisis, currently a health crisis, is not only a health crisis. It's a social crisis. It's a political, potentially a political crisis. It's an economic crisis. For those who are not very familiar, UNDP is the UN development agency. We're present in 170 countries and territories, so we're practically universally present. And right now, of course, we're mobilizing our presence to help with the COVID-19 response, but several things are really troubling us quite a bit. Of course, the Secretary General came out with his call to ceasefire for all warring parties. Whether that gets fully taken up, of course, we're still watching and seeing, but the continued violence issues are really, they have plagued our work in the past and they continue to do so, and it's a big concern. UNDP is the UN agency that works a lot on governance, rule of law issues, helping countries with anti-corruption, with setting up governance systems. In times such as this, in crisis, we are extremely concerned on issues of trust in institutions. These are the times where citizens and governments need to have clear communication, clear trust. Otherwise, response is able to be implemented. Yesterday, ILO, the International Labor Organization, came out with the outlook on the employment. Currently, as countries respond to the crisis with the social distancing and shelter at home kind of ordinances, of course, unemployment already takes toll. Unemployment issues take a toll on a developing world which was struggling already with issues of unemployment. We already had very high levels of unemployment across Africa and the Middle East, especially youth unemployment. These are being exacerbated right now, and those are issues that we're extremely concerned about. 55% of the world's population has absolutely no formal tie to a social protection system. So as countries are coming up with responses, these people working in the informal sector, in India, in Brazil, all of these populations that are going to be hurt much more than others, these are the big concerns that keep us up at night.
Thank you. And Stewart, let's go back to you. The WHO has been leading and coordinating with countries around the world to prevent, detect, and respond to the global health crisis. Can you give us a summary of the impact the WHO accomplished since it officially declared COVID-19 a global pandemic? And then also yesterday, we heard the president and other policy leaders criticize the WHO. What would you like people to know?
Okay, I guess I would thank you. I would break our response down into 5 buckets, and we've been full time, as I said, and full speed on this since December 31, January 1, well before the public health emergency of international concern was declared, and well before this was characterized as a pandemic. The first is we've been working to support countries to build their capacity through our 6 regional offices and 150 country offices to work with ministries of health and ministries of planning and other leadership in member states to get ready for COVID-19, which will stress every sector of society, and it requires real and deliberate planning. I think, what is the animal that it was in before it came into humans? And so there's still a lot we're trying to learn and to understand. How long does the virus survive outside the body? How far does it go when someone sneezes? All of these things are part of the work we have done to get accurate information out there. The third thing is we've been working to ensure the supply chain is addressed. There are many things that countries need to respond to this sort of a public health emergency. Everything from PPE or personal protection equipment, masks and gowns and other supplies that are used for barrier nursing. Everything from that to bleach and soap and reagents, and all of the things that are used in a primary care hospital. The supply chain is very heavily overstressed now, and so we are working to address that and to get material out. We have sent all manner of personal protective equipment and other things to the most vulnerable countries to help them respond. A lot of this is contained in our strategic preparedness and response plan, which was developed very shortly after the emergence of the virus and is now undergoing a further review. The fourth item is the working to mobilize and to train healthcare workers. There's a lot of information out there that they need to know about the virus, but also to get them properly attuned to infection prevention and control techniques, and to get them the guidance that they need. We've issued something like 50 sets of guidance since the pandemic, since COVID emerged. Some 1.2 million people have enrolled in our courses online to learn about how to work in a stressed pandemic setting. And so we're taking a lot of time to do that, and also leveraging the Global Outbreak Alert and Response Network, which is our emergency medical team platform, to help educate and get the workforce ready around the world. And it's a daunting task. The fifth and the most, from my perspective, the most strategic is the research and development work that we are helping to accelerate and coordinate. We don't have a vaccine for COVID-19, and we have we have ideas about where therapeutics are, what compounds may react to COVID-19, but we have got to have a research and development plan to determine what works and what doesn't work, what is just fiction and what has real data behind it. And so there is a lot of work going on in Geneva, coordinated by Dr. Soumya Swaminathan, who is the chief scientist of WHO, to develop an R&D roadmap and to accelerate progress on a new vaccine or a vaccine. A vaccine is the only real exit strategy for this virus. We have to have a vaccine. And so that fifth bucket is where we are spending an enormous amount of our time and effort. You mentioned some of the comments made yesterday and over the prior few days. I think the important thing to keep in mind is that we are in the early days of the worst pandemic of the last 100 years, or more than 100 years. It will stress literally every sector of our society. There won't be a person on earth, in all likelihood, who is not touched by this pandemic. We are focused single-mindedly on responding to it. And when I say we're in the early days, it may not feel that way to those of us who have been in New York or Washington or New Orleans. But think of it, the virus still has not penetrated some of the most vulnerable countries. It is not in the slums in Port-au-Prince, for example, or in other similarly stressed environments. And once it gets there, there is every expectation that it will explode, and we have to be ready for that. And so that is what we are focused on, single-mindedly. There will be plenty of time when the pandemic has been declared over to look and see what worked and what did not work, to look and see what was said that was good and helpful and what was said that was maybe not so helpful, not so accurate. We have to give time for that. Now is the great work to suppress this pandemic, and that must be our single-minded focus.
Thank you, Stewart. Let's keep all of that in mind and move on to Sarah. And Sarah, I'd like to ask you, as the threat of COVID-19 continues to rise, like you mentioned, women's workplace protections and access to reproductive health care is at a greater risk. How is UNFPA working to ensure that women's rights are protected around the world during COVID-19 pandemic?
Thank you so much, Rachel. So as as your question suggests, UNFPA is really working to address the unique needs of women and girls. And we're doing that in line with the Secretary General's three-step plan, also, in coordination with WHO and all the partner agencies who are represented today. So it's really a one UN approach, and we all have our roles to play. I'm just going to say, first of all, kind of an overview, and all of the work that UNFPA does, we do it within a human rights framework and a human rights approach, and the idea that no one is left behind. And that's similar to everyone represented here today as we're trying to meet the Sustainable Development Goals and ensuring that we address and meet the most vulnerable populations. I'm just going to quickly highlight the three priority areas that we are focusing on in addressing COVID-19. First is on the continuity of healthcare services and the protection of the healthcare workforce. We work in over 150 countries. We're working with national governments and other partners to ensure that we can strengthen healthcare system response. The unique risk for pregnant women and the unique challenges in terms of safe labor and delivery, ensuring that breastfeeding women are able to not transmit to their newborns, et cetera, are some of the priorities that we're focusing on. Continuing to also ensure that we are continuing with our ongoing work on treatment of sexually transmitted infections and addressing HIV/AIDS, and supporting GBV response in like a clinical health setting. One piece of our work that we do, and usually in a humanitarian context, but we're now including in this COVID response, is what we call provision of dignity kits. In this case, it's ensuring that people who may be quarantined or who are isolated, women have the things that they need, such as sanitary supplies for maintaining their menstrual health care. So providing that kind of supply. We could be providing safe delivery kits for women who might have no access to any other way to deliver a baby health and safely. These are very low cost, pretty simple interventions, but they can make a huge difference, whether in ensuring healthy delivery or the dignity of a woman who is isolated. A second huge priority for us is addressing gender-based violence, which is very complicated. Not only is there a spike in it, but also some of our tried and true interventions become more compromised when we keep maintaining social distancing, because often what we do is provide safe spaces, safe houses, places where women can go. We're continuing with that kind of response, but we have to find ways that we can minimize the risk and the specific risks of violence. So we do that work. Again, with many of the agencies here on the call, we, UNFPA, help to coordinate what's called the Gender-Based Violence Area of Responsibility. So it's a wide range of groups. We do this in a humanitarian context. We're trying to ensure continuity of services, whether it's psychosocial support, addressing the health needs of women, referrals. We have trying not to stop any of the pathways of support that exist, increasing hotline support, increasing virtual support, and also trying to use media to get messages out about addressing this. And then third is what Stewart mentioned as well, is that all-important supply chain and ensuring that modern contraceptives, maternal health medicines, and sanitary supplies are able to get to where they need to be. And this is a huge challenge. If you look at some of the media today, there is a lot of coverage on massive shortages of condoms. Several of the largest condom factories have had to stop production. I think the largest one is in Malaysia, and I believe it is now starting up again, but maybe at 50% workforce. So, and it's not just that, it's also ensuring that those workers are also protected as they do that kind of important provision of supplies, and that we are looking at the pipelines, ensuring the supply chain. So you can learn more on our website. It's www.unf, as in Frank, P as in Paul, A.org. I would particularly say, if you go on our website, we have come up with a very short report that is looking at COVID-19 through a gender lens. It's got a lot of fast, digestible facts, and might be something that those on the call who are particularly interested in. I've seen in the chat box a lot of questions about gender-based violence. You might find some really interesting data there.
Great, thank you, Sarah. And Jana, let's move to UNHCR. I participated in a learning trip on the Rohingya refugee crisis in Cox's Bazar and got to see firsthand how UNHCR is making a difference in the field. And I imagine that COVID-19 has, as you just mentioned, impacted the work tremendously for UNHCR. Can you give us a little bit more insight on how UNHCR is strengthening its overall preparedness, prevention, and response measures to COVID-19 around the world, including areas like Cox's Bazar?
Yeah, absolutely. Thanks, Rachel, and thanks for highlighting the fact that when people see our work on the ground, it really makes all the difference. With other UN agencies, we've participated in the joint appeal for increased funding. In that appeal, we identified 31 countries, although we work in around 135 countries. We started off with 31 that we consider to be at high risk for this pandemic. Of those, 11 operations we've identified as extremely vulnerable, either because of the number of refugees or internally displaced people in those situations, or weak health systems and infrastructure. The vast majority of refugees and almost all internally displaced are in low and middle income countries that already have weak health systems, challenges of their own. So in these key areas of operation, we're focusing on 6 key priorities. I'll run through them very quick. The first one, goes without saying, is public health. Public health response is for refugees themselves, internally displaced asylum seekers, and the host communities. As I mentioned earlier, most refugees and IDPs live alongside host community populations in urban areas. Even before COVID, a big part of our response was working with the World Bank and others and UNDP to provide more assistance to those host communities. This is more important than ever in the time of COVID. We have to be seen as helping host country nationals deal with this epidemic the same way we're dealing with refugees and IDPs. To do that, the term PPE, which I never knew until a few weeks ago, has now made its way into the vernacular. So we are increasing the use of PPEs. We're establishing isolation facilities. One thing that we sometimes bring in to refugee camp situations is what in the US we'd call them shelters. Sometimes they're referred to as containers. Some of them initially were produced by IKEA through a foundation grant. We can use those. They're very easy to set up. They're transportable. We can use them for isolation and containment centers. In Jordan, for example, I mentioned, most refugees aren't in camps anymore, but Jordan still has 2 very large camps for Syrian refugees. We're doing temperature checks at the entrance to the camps. We've worked with Doctors Without Borders to set up additional clinic spaces. We're setting up isolation and quarantine sites. So the second of the 6 areas is protection, which sometimes people wonder what it means. For UNHCR, it means both legal protection, make sure refugees aren't sent back to where they fear persecution. It also means access to all the rights to which they're entitled under international and domestic law. The restrictions on movement that we're all dealing with can have really profound impacts for refugees and others who are eking out a living even in the best of times and now have no opportunity to do that. One way that we're concerned with protection concerns is on the issue of borders being closed. This is an issue even in this hemisphere. Borders being closed, individuals denied access to asylum. We are trying to make the case that of course all countries have the right to take steps to mitigate public health concerns. We believe those steps are completely compatible with the right to seek asylum. In fact, they are mutually reinforced. If you allow access to asylum systems by refugees, you are undertaking measures to keep the entire population safer, both the refugees and the host communities. So we're trying to make that case. So protection, a big concern. The third key area is education. It's already been mentioned that the vast majority of refugees, displaced people children are out of school. This has dire consequences. It has consequences for our own children in this country. It certainly has consequences for refugee and displaced kids. Number one, food security is exacerbated when they're out of school. Sometimes this is the only way they have to get a meal. Number two, the child protection concerns that were mentioned that come up. When kids are out of school, they're more subject to sexual and gender-based violence, forced labor, early marriage, things that are happening even before COVID are still happening. So protection is an area we're focused on. The fourth is what we call WASH, water, sanitation, and hygiene practices. We are doing a lot to communicate with populations of concern about what COVID is, what mitigation steps they can take, social distancing, hand washing, all of that. It's very challenging where you have overcrowded camps or densely populated urban areas. Social distancing is not an option for some of these people, but we're trying to do what we can to enhance some of the crowded conditions, access to water points, where it can be challenging. Even unavailability of soap is something that we're seeing in a lot of places. Refugees sometimes can make soap on their own if we give them the raw materials. So soap making cooperatives are starting now. So this is really concerning for us. You mentioned Cox's Bazar. Bangladesh is probably one of the top examples everybody keeps asking about because you've got close to 1 million Rohingya refugees there. About 850,000 of them are in very dense conditions, and even communicating to them is difficult because unfortunately lack of internet access makes communicating difficult. So we're having to rely on some old school methods of getting the words out, megaphones, posters, relying on volunteers. We are increasing access to water points, to soap, to hand washing facilities. We're in probably a race against time in a place like Bangladesh. The epidemic hasn't, as WHO mentioned, it's one of the places we haven't seen it yet, but we know that time is running out. And with the monsoon season coming up, it's going to make it even more difficult. So we're very focused on Bangladesh. Real quickly, the fifth area is what we would call shelter and core relief items. Again, very densely populated camps and settlements, crowded urban shelters. We are fast tracking the building of new shelters, improving the quality of existing ones, and just doing more distribution of our ongoing core relief items, which they need in the best of times. Our last of the 6 key areas is cash-based assistance. You know, we try to do as much as we can through distributing cash anyway, because it provides a more dignified life. People can buy what they need and they can put money into the host community. Just like in this country, we need an economic stimulus for the people who are most vulnerable. And because they can't even work often in the informal economy now, they need more cash in hand to buy not only COVID mitigation items like hand sanitizer and soap, but they need it for the daily items that they can't buy because their livelihood has been taken away. One example is Yemen. We're scaling up cash assistance both to the north and to the south, the Houthi-controlled areas and the government-controlled areas, so that both refugees and internally displaced can buy the items they need to try to mitigate the effects of COVID. So those are our key priority areas.
Thank you, Jana. And Megan, let's go back to the conversation on education. You know, children are the most impacted in any global emergency. And you just said that 90% of children around the world are not in school due to the rising threat of COVID-19. How is UNICEF working to ensure that a child's right to education is even protected during this pandemic, especially in vulnerable regions around the world like Syria and Yemen?
Thank you very much. A great question. And I think as people said, we all know, and we're living it every day, the impact of school closure on children. And we obviously are living in a very privileged situation where there are alternatives that are being provided. So UNICEF is working across the world in 190 countries to really try first where we can to provide some continuity of learning, whether that's learning through the radio or learning through online. We currently have 87 countries where we have worked with the government to make some sort of learning continuity or online learning available. We also are planning for when the schools do reopen, how do we make sure that they can reopen in the safest ways? So obviously that's making sure, as Jana was saying, that there's soap, that there's water, so that the schools don't become a place that's actually a risk place for children. And as we said, we know the longer that children are out of school, particularly poor and low income children, we know that it's harder to get them back into school. So we're already working with ministries of education to try to plan back to school efforts to make sure that those children that are most vulnerable don't exit the education system altogether. So we're working along what we're doing now, what we're planning to do in the future, and then how do we deal with a kind of post mitigation phase of the pandemic. So I think that's obviously a huge part of our work. I also just wanted to point out to colleagues online, we've been putting a lot of the resources that we have on how to support online learning, but also how to talk to your children about the pandemic and have reliable factual information that's also targeted to children. So that's all available on the UNICEF website. If you want to check that out, that might be also valuable to you and your families here in the US. I think that the second thing I also wanted to highlight that's also been flagged by my other colleagues and Sarah in particular, as well as Stewart, is just because we're dealing with the pandemic of COVID doesn't mean that other health needs disappear. And I think particularly we are really concerned about, young children who need to get all of their routine vaccinations to make sure that they don't get measles or whooping cough. So those, ensure that we have a continuity of healthcare workers that can safely provide those services to children, but also that those don't get overtaken by the COVID response is really important, because we know in places like Ebola in DRC, where we've been working together as a UN family to fight Ebola, in the midst of an Ebola outbreak, you also have a measles outbreak. And that we really want to look at how we can try to prevent that as much as possible. I think the third area that I wanted to really talk about is UNICEF has for many years really focused on how to get kids to wash their hands. And that, as you know, as parents, washing your hands is one of the ways that we prevent so many diseases, diarrheal diseases, pneumonia diseases, etc. So we've been working for many, many years to get kids and their families to wash their hands. And so we have a lot of expertise there, and that we've been rolling out in conjunction with WHO and others to make sure we can get the maximum reach of making sure that people do the right thing. So we've had boy bands in Vietnam create, fun songs to help people wash their hands, really try to work all of the social media to really bring that expertise of, this is something that we in the development community have been working on for a long time, and we now need to bring this to a global perspective. And I also just wanted to end with two other points. I think, as everybody has said, we're trying to get all of the logistic and supply capacity of the UN to make sure that we're responding not just to the initial needs to fight the pandemic, but to make sure that we have all of the essential supplies to make sure that essential workers can do that safely and we can continue our programs. And we've done things that we in some ways haven't done before as UNICEF. We provided supplies to Italy, which was not something that we would usually have done, but we had a call from the government to help them with some of that urgent supplies. We have planes that are landing today in Venezuela. We've delivered hygiene and water purification supplies to Senegal. So around the world, really working on what Jana was talking about, not just being, to be able to wash your hands, you need safe water, you need soap, you need a predictable supply of all of those things. And then the last thing I would just mention, as Sarah has said, I've been very struck by how much, particularly in the US and in Europe, there's been discussion about the rise in the prevalence of domestic violence in the context of people being confined to their homes. And I think we just need to really be aware of how much that also affects children that are in those situations. So trying to continue, as was mentioned, hotlines or contact with childcare social workers so that those most vulnerable children, when we think of when we can be safe, that we're at home and we're safe. In their perspective, sometimes home is not safe for them. So we need to continue those programs as well. Thanks.
Thank you. And Yesim, before we move into Q&A, I just want to say that UNDP has been helping countries to prepare for the response to the COVID-19 pandemic. What are those response efforts we can expect in the weeks ahead as the challenges of COVID-19 continue to unfold?
Thank you, Rachel. As colleagues said, we've all mobilized to help countries prepare one way or the other, of course. UNDP's looked at, has a three-pronged approach that represents essentially the type of demands that we're getting from the governments of the countries we serve. We're preparing through health system support. And that includes a lot of the mentions made with respect to buying equipment, medical equipment. But what we're doing is helping governments buy the equipment from the market and mobilize the resources they need to do that. Just yesterday, for instance, we worked with the Bolivian government to quickly put together its application to the World Bank, gets resources so that they could procure PPE and other equipment from the market. And all of this we do under the sphere of WHO. We're doing similar things in Madagascar, Guinea-Bissau, Mozambique, helping the governments to procure their medical supplies that they need, from PPE to all the others. We're in the business of waste management. All of the PPE equipment, all the stuff that's used, medical waste, is piling up in hospitals. So we're helping systems, health sector systems, manage the waste management. We have a lot of experience, unfortunately, from the Ebola crisis, where we've worked with WHO and other colleagues in salaries and making sure that ministries of health are able to pay the healthcare professionals who are so valiantly putting their lives at risk, addressing the issues. So in the preparation side, we're trying to work with the health sector systems. The response, which is the second side aspect, is not only health sector. It is about the entire government system of countries. In our country here in the US, there are all kinds of task forces established, continued business continuity plans. So we're doing exactly the same type of systems with our host country governments in the FEMA type equivalent entities, setting up situation rooms at ministries, setting up municipal situation rooms and response facilities that are outside the health sector, including through communications. And finally, countries are doing all of these together. They're preparing, as Stewart said, preparing in countries where it hasn't hit yet. They're preparing, they're trying to respond, but they're also trying to recover and put in recovery plans already. So these include things like designing employment assistance, unemployment schemes, or social assistance schemes for those in the informal sector. So we're doing also the recovery simultaneously. We're creating policy places, for instance, in Latin America, so that these countries know how to manage slowly opening up their economies. These are the kinds of activities we're doing in 3 prongs.
Thank you very much. I know that we're short on time, so I'm gonna get rid of my last question and have Farah pull some questions out of the Q&A box. And I would say if you can maybe try to answer them within a minute would be great, so we can get as many in as much as possible. So I'm gonna move to Farah so we can get our first question that came in.
Wonderful, thank you. And there were quite a few questions, and I tried to pull one for each of our panelists. The first question is for Jana. This comes from Taqwa Zahid, who asks, do you think that with the current pandemic, states would be more hesitant in accepting refugees? And if so, how are they getting their essential needs?
Thank you very much, Taqwa, for that question. The short answer is yes. I think in terms of when you say accepting refugees, I imagine you're talking about both the refugee resettlement system, which is where a number of countries around the world agree to fly refugees from the host country where they are currently living and they're vulnerable, and admit them legally into their own country. That system, unfortunately, but understandably, is on a pause right now because there's so many travel restrictions. Understandably, we don't want to risk people getting separated, children being separated, people being stranded. So for now, the formal refugee resettlement program is on pause. The other way countries accept refugees is when people arrive at their borders or in their country through another means and they request asylum. That happens in the US and other Western industrialized countries. As I mentioned earlier, we are advocating strongly with governments to keep that safety valve open and allow people arriving at borders to access asylum procedures, which we believe is entirely consistent with public health measures to protect the entire population. And we're happy to provide technical assistance to governments. In the meantime, while there are challenges both with asylum and resettlement systems, we're doing what we can to continue providing protection and assistance for the most vulnerable refugees wherever they are, in anticipation, when this is over, of resettlement systems opening up again and hopefully border closures and border mitigation measures being eased up as well. But thank you for that very important question.
Thank you, Jana. The next question is for Megan. Vanitha has asked about, in the news, we are hearing that children are less likely to catch and or spread the disease, but we hear conflicting information from medical professionals. Can you share UNICEF's guidance in this regard?
Thank you very much. A really good question. And I think this also goes to the issue of what Stewart was talking about in terms of what we know about the virus and how that is evolving. I think we have seen in the early data that has come in is that we're not seeing children as being heavily affected by the virus in terms of getting sick. And I think what we're still looking at is how do we understand, are they getting the virus and able to transmit it while not getting sick, and exactly why that is the case. So I think it is one of these areas that we're looking at learning. But what we also know is that particularly one of the areas of social distancing in terms of closure of schools, because we do believe that children are able to transmit the virus and potentially bring it home to their families. So it is an area where we need to do more work. And I think also, as we've seen in different countries, the age or the demographics of people most affected, while obviously mostly being those people that are older and with pre-existing conditions, it has changed. And we have seen that there have been different age cohorts in different countries that have changed. We are very happy that so far we haven't seen a very large level of sickness in children, but it's something we need to watch very closely.
Thank you, Megan. The next question is for Yesim. Kulsum asks about what efforts should community leaders engage in to ensure communities minimize risk and the people who are hurting.
Thank you so much for the question. We're working quite a bit in reaching community leaders and trying to reach out to minority communities, hard to reach communities through both communications, but also through our health sector response. But I think the basic etiquette of rule of law and good governance holds, especially true at times like this, where community leaders are heeding the needs of their communities, where they respect the democratic rules of engagement, of women's participation through whatever means. And that's why, for instance, with many countries, we're putting together the business continuity plans so that systems and governments and political leaders can engage with their communities. But I think I don't have an off-the-shelf answer, but I think the basic rules of democratic engagement, of open governance, of open systems, being transparent, accountable, all of these become so much more important in a time of crisis, where good governance principles of transparency, accountability, respect for human rights become so much more important. And that would be the main advice to community leaders, is to hold those principles. They are also the UN principles in mind in leading responses.
Thank you, Yesim. The next question is for Stewart. Stewart, Mel Boynton asks, you said that the end game on COVID is a vaccine. What are the best hopes for the development of a vaccine, human trials, and mass distribution? Could vaccines be available sooner than a year from now?
Well, I think this is an open question. A year in the life of a development of a vaccine is a blink of an eye. It ordinarily takes much, much, much longer. There has been a fair amount of work going on with coronavirus immunization, understanding coronavirus and the immunoregulation system since SARS in 2003, and then it ramped up with MERS. So there is a fair amount of work that has already occurred. Dr. Fauci says something on the order of a year and a half, but I know that we and others are looking at all manner of approaches to accelerating that. The vaccine is what we must have. And so we are looking at literally every possibility of accelerating that. And that's something that Dr. Tedros has entrusted to Dr. Soumya Swaminathan, who is the chief scientist at WHO. And she has a group with her who are working on this with scientists all around the world, from the NIH to the Medical Research Council of India, all over the world, working on, to the Wellcome Trust, working on Institut Pasteur, working with all of the thought leaders and centers of excellence for vaccine development to accelerate research and development. I would be reluctant to give you any sort of a guarantee, but I think that where there is united will and a really a coherent and universal recognition of the need, it is possible to accelerate well in advance of what the ordinary timelines are for the development of vaccines and other medical countermeasures. So I think that is our aspiration. That is our objective, and it is something Dr. Tedros feels very strongly about. Yes, we accept that a year and a half, even a year and a half, is a ambitious target, but we are looking at every possible way to accelerate that.
Thank you, Stewart. And our final question is for Sarah. Sarah Herberstock asks if UNFPA could receive supplementary funding for, say, $50 million, how would these resources improve your response and impact?
Wow, well, if someone on this call has a check for $50 million, we would be happily accept it. We have an appeal. We are part of the general UN appeal, and we have a specific appeal that you can also find on our website. And those resources would address a lot of the things that I'm talking about specifically. And the 3 priority areas: addressing sexual and reproductive health, making sure those services don't end, addressing gender-based violence, and the supply chain piece. But I guess I'll use this moment to put in a push that if we had $50 million and a question that I thought we were going to be asked about what gives us hope, I'd want to address that to frontline, and this is if I was running UNFPA, I would want to address it to frontline healthcare workers. And this week was World Health Day, and it was a real opportunity to thank and praise healthcare workers who, as I say, are particularly women. And this year is also the year of the midwife. And midwives are a core partner and a core group of healthcare providers that UNFPA works with. I have been very impressed and inspired by the number of midwives who are going forth, having to find ways to bring new life into the world and to give them the resources, the protection, and the training they need to be able to do that safely would be a great use of additional resources.
Great. Thank you, everyone. And I'd like to thank the panelists for taking time out of your busy schedules to be with us today and to inform us how your agencies are fighting COVID-19. You definitely, by listening to you, have re-energized us as UNA USA members to continue to support and advocate for your work. I also want to thank our attendees for participating today and would love to suggest the following next steps you can take so you can also make an impact on fighting COVID-19. So first, I would say encourage you to follow the UN agencies we heard from today on social media and share their stories in your networks. I would also say that you could give directly to the COVID-19 Response Fund that is sponsored by the UN Foundation. You can do this on your phone by texting WHO or 25 or WHO 50 to 501-501, and your donation will support the work of WHO and also now UNICEF. And then most importantly, I encourage you to join the United Nations Association of the USA at unausa.org. With over 20,000 members, 60% who are under the age of 26, and more than 200 chapters across the country, we are united in advancing the UN's mission and achieving the Sustainable Development Goals. And finally, as I mentioned earlier, the Global Engagement Online Series is a year-long program, and I hope you can join us for upcoming programs in the coming weeks. So you can text GEOS to 738-674 for more information. Once again, thank you everyone for participating today. I hope you all stay safe and stay well. Thank you and have a good day.
Thank you.
Thank you.